Chair now recognizing Mr. Krishnamoorthi for 5 minutes.
Can you hear me now?
I hear you now.
Okay, great. Thank you, Mr. Chair. I'm the co-chair of the Global Vaccination Caucus in Congress, so this is a very important hearing. Let me first ask Professor Russ. Dr. Russ, it's correct that vaccinations abroad could relieve supply chain disruptions, correct?
Yes, in 2 ways.
I want to just build on this question. And reducing supply side disruptions will in part tamp down price inflation, correct?
Yes.
And therefore global vaccinations would help fight inflation, right?
Yes.
Do you have an estimate of how much inflation would go down because of global vaccinations?
No.
Would it be a substantial portion of the inflation that we see?
It's hard to tell. The relationship between the price of imports and the impact on our domestic inflation is not linear. So if you think about the contribution of the shortage in semiconductors, it generated these shutdowns in US auto production that contributed to keeping prices high on autos in the United States. Right now, autos contribute to 1/5 of the inflation that we're seeing. That's not all because of the vaccine-related supply disruptions.
I understand. Dr. Uday Kumar, a new study came out from South Africa today suggesting that the Omicron variant may cause less severe disease, and they found a 29% lower risk of hospitalization. However, they also found that in the UK, members of the same household were 3 times more likely to pass on Omicron than Delta. So if we have 29% fewer hospitalizations, but 3 times more people infected, that would produce more hospitalizations overall and would potentially overwhelm hospitals in this country, would it not?
Yes, Representative Krishnamoorthi, it's exactly right. We like to think about transmissibility, immune evasion, and severity as different variables that impact, and certainly the significant increase in transmissibility is quite worrisome.
Since the Delta variant became the dominant variant in the US in July, almost 200,000 people have died from COVID-19 in this country. Given that the 2-dose vaccine regimen is less effective against Omicron, and natural immunity is less protective against reinfection with Omicron, and it's significantly more transmissible, yes or no question, are we likely to see tens of thousands of deaths in the US alone because of Omicron?
I would say it's probably too early to tell because we don't really know the questions around severity, but it is likely that we will see that level of deaths in the US over the coming months.
So, one of the things that I'm pushing along with my co-chairs of the Global Vaccination Caucus is $17 billion more in FY22 appropriations for the scaling up of manufacturing capacity of vaccines. And what I wanted to ask you is, would you agree that this additional $17 billion for the purchase of vaccines as well as the scaling up of vaccine capacity is needed right now to combat the lack of vaccinations globally?
Yes, Representative Krishnamoorthi, we are still tens of billions of dollars short in the global response. I would just note, in addition to vaccine manufacturing and purchases, the additional bottleneck going into 2022 is really going to be on the delivery side. So country level readiness is also something we need to invest significantly in the billions of dollars.
I'm glad you brought that up. So I've introduced legislation called NOVID. It's a play on words, no more COVID. 120 of my colleagues and I urge that this be adopted as part of our legislative process going forward to help make sure that we combat the problem of a lack of vaccines abroad. Let me, Dr. Ali Khan, I read in a recent piece by Dr. Makari that back in the spring of last year, natural immunity apparently had had reached a very high level. And he said, quote, "I expect COVID will be mostly gone by April 2021. That wasn't the case, was it?
No, it wasn't. And anybody who was a field epidemiologist, public health expert would have known that.
Thank you. I yield back.